Okay, our patient today needs a wet to dry dressing change. So I'm going to show you how to do a wet to dry dressing change. This is going to be a clean procedure. Depending on how the doctor orders it, maybe he wants it done with sterile technique, but this way I'm going to show you clean. Anytime you do any type of a dressing change, you need to read the doctor's order specifically to see what he wants it packed with, what he wants it cleaned with, and how he wants it done. For the most part, any type of surgical incision is considered sterile and you would have to use sterile process. We're going to do this one clean though. What you're going to need is, number one, you'll have to assess your patient and see if they're hurting. You don't want to do a dressing change, especially a wet to dry dressing change, because they're very painful. It debrides the wound. You want to assess their pain level and go ahead and medicate them with something for pain if needed. And then give them about 30 minutes and then go in and do that dressing change because you don't want them to hurt. With a wet to dry dressing change, we're going to put 4x4s in it that have been dampened. Then as they dry, they attach to the unhealthy tissue in the wound bed, and then you pull it out and pull that dead tissue out with it, so it can be very painful. So what we're going to need are gloves. You will change your gloves 3 times during this. I'm going to put a pad to protect the bed. I have got some sterile normal saline that has been open less than 24 hours. I've got some tape. I've got a Sharpie. I've got some sterile Q-tips. I've got surgical sponges. I brought 2 packages. I've got an ABD pad that we're going to be using. This is a 5x9 and we're going to use it to cover the wound. And I have got a piece of paper to write my measurements down in case I forget. And then I've got my measuring device that we're going to use. And you've got one of these in your kit. Wounds are always measured in centimeters, not inches. So be sure that you look to see how you're going to measure on the centimeter side. Okay, so we're going to knock knock. Hello, Miss Smith. My name is Shelly. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay. I provided privacy. I've already pre-medicated her. I'm going to be doing that dressing change on your leg. Do you have any questions? No. Okay. Get my garbage can. I'm going to pick my bed up to a workable height. To lower my side rail. Let me see this. And I just got my garbage can over. And surely I'm not going to have to start over because I can't find the lower the side rail. Get prepared to. There we go. Sorry about that. Lower the side rail. Okay. So our wound is on the patient's thigh here. I'm going to turn it. I may have to position her on her side if need be, but hers is on her thigh. I'm going to provide her privacy. I'm not just going to expose her to the world. I want to protect my bed, so I would put something under the area just in case. Okay. Put on my first pair of gloves. And I'm going to remove the old dressing. Now you just don't want to rip the tape off. To take tape off of a wound, you want to start at the corners and loosen the corners first. and work your way toward to the inside. You want to be careful that when you remove the tape that you just don't pull it off, because you can actually tear their skin. Pull it to the inside. Okay, I'm going to lift it off. Okay, now I'm going to remove the packing because it's wet to dry, so this packing should be dry. Now if I go to remove it and it is really super stuck and I don't want to damage healthy tissue, what I can do is take some of this saline, lip it, and wet the gauze in order for it to pull out easier. But this one doesn't stick, so we're going to pull it out easily. And when I pull it out, I'm going to look at that wound bed. I'm going to look at this, the packing. I'm going to be sure I got it all out. I'm going to see the color of it. I'm going to see the consistency. I'm going to look at the amount. I'm going to look at the odor. Does it have a smell to it? And I'm going to assess how the patient is tolerating it. So I've got the old one off. So I'm going to fold this up and I'm going to put this in my first set of gloves, because sometimes these can be really smelly and off-putting if someone sees them in a garbage can. Okay. So now I'm going to put on my second set of gloves. And I'm going to measure. Well, you all right, Miss Smith? I can't get my package open. There we go. Okay. So first thing I'm going to do to measure, you have to do the length, the width, and then the depth. So here is, now these are disposable. Now don't throw yours away in your kit. You need to keep it when you practice. But in real life, once you touch this to your patient, then you have to throw it away. It can't be laid back on the table or anything because you've contaminated it. Now, if you see the circles, you can always lay it, put the center in the middle, and measure it. But as you can tell, our wound is too big, so we can't do it that way. So we're going to use the centimeter portion, or the metric portion. And we're going to do the length, which is 11.5, so 11.5 centimeters. And you go by the longest portion and the widest portion. So 11.5 by 3.5. 11.5 by 3.5. So I want to write that down. Now we've got to get the depth of it. So to get the depth, you take one of your sterile cotton tipped applicators, and you're going to put this into the deepest part of the wound. And you're going to slide your fingers down to where you're level with the skin. Then you're going to pick it up and you're going to measure the depth. So it is by 2. So it's 11.5 by 3.5 by 2 centimeters is the measurement on this wound. And I would throw this away. Okay, now I'm going to get my stuff ready to pack it. Open. This is my normal saline. If the doctor wanted it cleaned with anything in particular, you would clean it at this time, but we're just going to pack it with the normal saline gauze. Okay. It looks like it's going to need about 2 of the 4x4s, and in this package, there are 2 4x4s in it. These are says surgical sponges. I will show you a trick on how to wet them. You loosen the top and get a little pocket. You take this, you lip it, because it's not a new bottle. Then you pour into this package enough to wet it. Because you want them to be wet, but you don't want them soppy, and you want them to stick. And I'm going to. That way you can just wring the extra water out. Someone taught me this trick a few years ago. It would have saved me a lot of time in my youth. So we've got that. I'm gonna go ahead and open it. I'm gonna go ahead and open my ABD pad. Now, if we needed more gauze sponges, of course we would wet them, but I think that those right there will be enough. Open away from me. I'm gonna put on my last set of gloves. I'll drop that one. Now, if you needed to do this sterilely, then right now would be the time that you would put on sterile gloves. We're going to say that this is a bed sore or a decubitus. It would be about a stage 3, and they're considered dirty wounds, so we're going to do it clean. So now we've got to pack our wound. And we cannot touch the inside of the wound. So we're going to use our other cotton tip applicator. Now this is too wet, so I'm going to wring some more of that out. A wound bed that is too wet will not heal. Now we just can't just lay these in there. We have to fluff them up because we want the gauze to get in really all the little nooks and crannies in that wound bed. So I'm going to attempt to fluff this up. And by fluff it up, I just mean stretch it out and unfold it. Okay. I'll unfold it a little bit. That should do. I'm going to unfold my other one. Should do. And I put it up in my hand. Now, I do not want this gauze to touch the outside. We don't want to drag anything off of the skin into this wound. So you can kind of take your Q-tip and place it into that wound. And this kind of guides that. Now, that fell out, so I'm not going to stick that in the wound bed. I would probably take that out and start over. So don't judge me on this. Let's take it out and do a quick do-over without redoing the whole video. I could always wet another gauze and just not use this one, but I don't want to waste. Let's try it again. So I'm going to put it into the wound. And I want it packed, but I don't want it just cram-packed. I want it sort of lightly. I don't want to cooperate with me today. And that little spooch there is hanging out, and I'm not going to put it in there. Straighten this one out. I'm going to take my Q-tip and place it in the wound bed. Okay. Throw that away. Now I'm going to cover it with my ABD pad. And if you looked at your ABD pad, there's a side that's got a blue line on it. That goes out. That's the outside. This is the inside. You don't want to touch the inside of this. That's the outside. So you're going to lay it over your wound bed. Now we're going to tape it. And you can take your gloves off to tape if you want to. I think I can do it with them on. Okay, I can't use that one because it fell on the bed. So I would get a new ABD pad. and I'm going to tape all 4 edges. I'm gonna have to do this one over, sis. I'm going to tape all 4 edges. Then I'm going to date and time it. You never write on the wound like that. What's today's date? It's the 14th. And we're going to call it 2 o'clock, so 1400. And my initial. So I've dated it, I've timed it, and I put my initial on it. And I'm going to put that right there. I'm going to clean up my area. I'm going to wash my hands, put the bed in lowest position, give her call light, and ask her if she needs anything, and wash my hands, and then document. There's something I want to say about writing on the wounds. I know that probably a lot of you have seen a nurse go ahead and just write directly on the wound. There's only really one time that's acceptable to write on a wound. Let's say you go into the patient's just came back from surgery, and the doctor has ordered not to take the dressing off. But when you go in, you notice that there is a spot of blood on the dressing that has already bled through. At that time, you can take a Sharpie and outline where that drainage is, and maybe write the time next to it. So at 2 o'clock, that's how much drainage was on it. That's nothing to be alarmed about, really. You come back in 30 minutes later, and there's this much blood on it. So this is at 1430. This is at 1400, since we're doing military time. So, okay, the patient's been moving around. You come back in 30 minutes later, and there's this much drainage on that wound at 1500. This gives you something that you can call the doctor about. And you can call the doctor and say, hey, this is Shelly. I've got your patient back from surgery. You said not to take that dressing off. But at 2 o'clock I went in, and there was about a quarter size of drainage. 30 minutes later, it had kind of doubled. And now the whole pad is essentially saturated. What do you want me to do? And he may say, take the dressing off and change it. He may say, reinforce it, and I'll be up there in a few minutes and look at it. Or he may say, that's fine, don't worry about it. Then of course you just document. But if you've got it outlined, and whenever you do outline, you need a Sharpie marker or something soft. You cannot take an ink pen and bear down onto a wound, or you can do damage to the skin under the dressing. And that's one of my pet peeves. I see nurses do it, and I don't like that, and it's not appropriate. So be sure that you're just outlining. That way it gives you a point of reference for the doctor, and your doctors will appreciate it, and they will respect you for it. And that's it. Thank you.